My name is Barbara Kerpler, and this is my presentation on neuropsychology and neurocognition in perspective of our aging brains and the effect of substances. Colorado Christian University student from the Department of Psychology in a psychology major, one of my last classes, and I've had the greatest experience, and this is going to be one of my favorite subjects to have worked on. Our magnificent brain processes. Did you know the brain weighs approximately 1.4 kilograms, produces our thoughts and memories, feelings and emotions, and experiences that we have in the world? The brain is composed of billions of nerve cells called neurons, and each neuron is formed of thousands upon thousands of fiber connections that transmit messages via the neural net. The fibrous structures are called synapses, and they transfer information from release sites to receptor sites. The purpose of transmitting those messages is so that the mind can record memories and store them in a little unit in our brains with our learning habits. In result, it produces our personalities and characteristics. As time goes by, the brain ages and our information processing becomes altered. The brain develops a shrinking. Because of the shrinking, the brain loses its sources of dopamine. Dopamine depletion results in loss of dendritic connections, and myelin deterioration begins. The deterioration of the nerve fibers that carry messages to the central nervous system begin increasing calcium conduits, causing neuronal communication impairments in gene expression and increased protein production that affects memory, reasoning, spatial, language production, executive functions, and motor function, among just a few. Transitional factors include physical health vulnerabilities, such as weight gain or weight loss. Our bodies are beginning to slow down with the fast-going changes that are surrounding us. We begin experiencing psychological and psychosocial changes. We become at risk for chronic disease and illness, such as congestive heart failure, musculoskeletal injury or pain. Arthritis and degenerative disc disease begin setting in on some of us. Our mental health becomes a problem. Some may experience Alzheimer's disease, Parkinson's, dementia, depression, anxiety, or excessive worry about the environmental variables surrounding them. All of these contribute to vulnerability to neurological and psychological disorders and psychiatric disorders, compromising our health, creating pathological implications, and eventually decreasing our quality of life. When substances are induced, such as alcohol, marijuana, opiates, heroin, off-the-street drugs, it becomes a problem for our brains. If you notice, I've placed two of the examples here. The first one is alcohol, and we're going to have fun with this. We've all consumed it, and we've all remembered what happens when we do. Our brain becomes very dizzy. The released fibers, connections go from our brain, sending signals to the receptor site, which is our stomachs. And then our brain decides to create a plan. We're already impaired in our reasoning. Our psychomotor functions are slowing down. We become confused, which is in the areas of the Broca and Wernicke that control speech and language. A message gets sent to the hypothalamus, the basal ganglia, oblongata, and the cerebellum, alerting the brain that something is about to happen, and it's not going to be very pleasant. The spinal cord aids in an important factor for vomiting reflex, which is a behavioral response. Cognitive neuropsychology. The approach began in the late 1950s and 60s through retrospective works of Jean Piaget and Edward Tolman. Tolman was an American psychologist and behaviorist who described his theories in psychological research as stimuli and response reactions. He referred to this as cognitive map, which is something that we've learned here at CCU. Tolman's contributions to psychology and today is known as purposive behaviorism and latent learning, which was first theorized by Blodgett in 1929. However, because of our technological advanced systems now, the tech generation gave a lot of rise to the complexity of the human brain by comparing it with artificial systems such as computers. Human minds and computers? Yeah, it is kind of similar. Wolfgang Kohler described the mentality of apes and chimpanzees in his 1913 studies. He demonstrated that the chimpanzees and apes were having very intelligent behavior. And anyone who's ever seen any documentaries with apes or chimpanzees, you'll notice that they are very small or very large, intelligent creatures. And there is a reason for it. Edward Tolman studied observable behavior. He found challenges with John B. Watson's behavioral learning theories. He found that it was limited and reflective of a conditioned habit. In 1932, purposive behavior in animals and men became goal-directed as the underlying actions of varied muscular movement, organized around a serving purpose, guided by cognitive processes. In 1967, Ulrich Neisser proposed the concepts of perception, pattern recognition, problem solving, and remembering, emphasizing on information processing in the brain, constructive processing functions, and providing alternatives to behavioral researchers, giving them a little bit more insight. He was also known as the father of cognitive psychology and advocated for ecological approaches to cognitive research. Past and present research models for behavioral models, cognitive models, neurocognitive models, and neuropsychological models have grown over the years. My focused area of research is going to be cognitive psychology, the theory of planned behavior, and the functional areas of the brain. My neuropsychological cognitive projection model will include knowledge in neuroscience, neurocognition, neuropsychology, psychological stress response, and psychosocial behaviorism. Functional components will consist of cognitive function, localization of neural activity that is responsible for cognitive tasking, mediational processes, crystallized fluid intelligence, and heterogeneity decline. In my psychological assessments, structures and process will be reviewed, contrast perception, motor preparation, language production, executive function, cognitive deficits, and behavioral effects. Alternative approaches must include theological and spiritual reference approach, theories, case studies that are valid and reliable. Must identify environmental barriers for clients. Once you've identified those barriers, cognitive behavioral retraining is applicable with modeling and conditioning techniques using holistic measures. For diagnostic tests, any of the following: neurosonograph, EEG and EMG events, magnetic resonance, MRI, computed tomography, nerve conduction velocity, and Doppler ultrasounds will be helpful in detecting any type of abnormalities in the brain. When I get old, do not cast me away when I am old, for do not sate me when my strength is gone. Remember the days of old, consider the generations lost past. Ask your father and he will tell you, your elders, and they will explain to you. There are resources in case you'd like to review any of the information provided here in this presentation. Thank you for watching, and God bless.